Hey, what's going on? It's Ian Hart here with earthfittraining.com, backpainrelief4life.com, and mybackpaincoach.com. So right now, today, I'm going to go over how to loosen up your thoracic spine. So if you feel like you're in this position where your body's starting to hunch over, you get tightness in the thoracic region of your spine, and you're also tight in your pecs, this will help specifically with your thoracic spine. Now, it won't help with the pecs completely, but we will get a little bit of a stretch in the pecs while we're creating mobility in the thoracic spine. Before you do any type of exercise, it's important to warm up. If you've seen my videos before, I always talk about warming up, and there's numerous reasons to warming up, but specifically for this, because we're going to be doing stretching, there's more blood flow, nutrients, and oxygen to the area, and you're going to get 10 times the results. And many times it shows that if you're not warmed up or you're cold, you not only won't get the results, but you can actually just exacerbate the issue. So we're going to start off, warm up for you. You could go out and jog for 15-20 minutes. That's going to be the best. I'm just going to do some light warm-ups now so you can get started on this, and it's going to be targeting specifically the thoracic region. So we're going to start off by keeping the knees locked, reaching to one side. We're going to just loosen up the lats. So we're going to reach and start to get oxygen into the body. So breathing in. And now if you're very tight here, you should feel the stretch in your lats. Like for me, this is always a tight spot. You'll feel it down in the hips, almost all the way up. And this attaches on the inner part of the humerus. So it actually, if it's tight, it pulls you into a protracted state, which is in that position. So we're just going to start loosening up this area. Deep breaths in through the nose, out through the mouth. Okay. All right. Now we're going to just do little circles of the thoracic spine. So we're hunching over. And the other direction. All right, typically you want to warm up a lot more than that, but we're just going to loosen up. Now I'm going to grab a band here, and I'm actually going to step out here. If you can see me, this band is attached to the TRX right now. You want to probably attach it to something more stable, but this is done for filming purposes. And now I'm just going to gently pull. This is actually a pretty tight band. So now I'm actually stretching out the thoracic or the lats a little bit more here. If you notice, I'm making a bow with my body, so my right leg is back behind my left leg. You can't really see that well, but I'm bowing my body out completely. Right? You might see it a little bit better if I move back here with the other side. So I'm making a complete bow with my body. I'm getting a full stretch in my lats, all the way up here too. And then if I just gently pull, I'm activating the lats, and this is stretching it out a little bit more. And each time I let it pull me back a little bit further, so I can go more into a bow now. All right, so that's just to show you, I would do at least 10 reps, maybe 2 sets, to loosen up this area a little bit more. Just doing that right there, I feel the activation of my lats and the stretch. And now I have more range of motion instantly, and this is going to help tremendously with the mobility of our thoracic spine. All right, so now let's move on to the next thing. The next thing we want to do here is we're going to grab a medicine ball. And now the toughness or the hardness of the medicine ball will depend on your mobility at this point. You probably want to start off with something very soft, but not too soft, because then the ball is just going to mush down. So let me show you here. The next thing we're going to do is lay down on the medicine ball in our thoracic spine, never on the lower back. We're never putting it on the lower back. So let me move back so you can see it a little bit better here. Okay? So it's right on my thoracic spine, right on the tight spot. So what I'm going to do is I'm just going to lay back Right now I'm getting a pec stretch as well. And you can get more of a pec stretch if you just rotate your arms up and down. And right now I can feel, you might actually feel your thoracic spine kind of adjusting into that position, hearing, little pops. Just this position will create great mobility in the thoracic spine. I usually have people lay there for about a minute or so. And now that has put the thoracic spine into extension when it's used to being in flexion. So just creating that mobility will connect the brain with those receptors around the thoracic spine, which will help to loosen the area up. Remember, when you increase proprioception, that's the brain's awareness of the body and space, instantly stress levels go down and threat levels go down. Okay, now the next thing we're going to move into, and this is something that I do manually with clients. I actually have them put their elbows on my arm like this, and I'll actually stretch them out. I'll show you what it will be in a second here, but you can do this yourself, and I do it myself all the time. And the way that I do that is I put my hands behind my head. This is something I learned from Dr. Stuart McGill at one of his workshops for thoracic tightness. And I'm putting my elbows down on this chair right here, and I'm going to press down into the chair so that I'm activating the lats, and this is like a PNF stretch. A PNF stretch is proprioceptive neuromuscular facilitation, so we're activating the muscles, and it's relaxing what's called the Golgi tendon organ, and then the Golgi tendon organ is what creates like the defense mechanism which prevents you from stretching further, so it stops that from happening so you can stretch a little bit further. So here we go. I'm going to press down into the chair, engaging my lats, and now I'm going to stretch out, sit back on my heels a little bit further. Now I feel a deep stretch in my lats, and then again I'm going to push down. So we're going to hold it down for 6 seconds as we press down with the elbows, and then stretch out for 8 seconds. So if you notice, my stretch is getting much greater. My thoracic mobility is much better. I've been doing this program a couple times a week here now. Okay, and press down again. We're going to do one more set. And now I'm going to move back a little bit further and get a little bit more mobility here. All right, so this is very good for me. I just tore my pec muscle off the bone and had it reattached, so that area is a little bit tighter too, so it's helping increase my mobility of the whole shoulder. So now, the last thing we're going to do is go into what's called the child's pose. All right, there's many ways to do this. I'm going to show you one specific way to help your thoracic spine. So what you're going to do, sit back on your heels. You're going to crawl out as far as you can. Okay, sitting back, you're going to crawl. Keep crawling with your arms, not moving your butt at all, just moving your hands. And as you move your hands, you should start to feel the stretch in your lats here. Okay, take a deep breath in. Exhale and crawl a little bit further. Try to feel a deep stretch. And now what we're going to do is crawl up and to the right while you push your torso to the left. You'll see it a little bit better when I do the other side. Deep breath in, exhale, and then crawl up a little bit further. I feel a deep stretch into my lats right now. And same thing, we're going to do 3 sets. Pulling for 6 seconds, and then relax and crawl a little bit further. Okay, let's show you on the other side. So right now I'm going to crawl up, and now I'm going to gently push down into the ground and push out this way so you feel here, and then relax, and now I'm going to crawl up a little bit further. Deep breath in, feel a full stretch, And now push out a little bit more, push down, and relax and crawl up a little bit further. All right. So, right now, you should feel your thoracic spine loosened up. You should feel your lats loosened up. Like right now, my chest opens up way better because I increased the mobility in my thoracic spine. Now keep in mind that your thoracic spine should be mobile, your lower back should be stable, and your hips should be mobile. What happens to people who are sitting down all day or who are hunched over all day is their thoracic spine becomes stable. Yeah, the thoracic spine becomes stable, the lower back becomes mobile, and the hips become stable, opening you up for a chance to injure your back. Because if your back becomes stable when it's not supposed to be flexing and extending in the ways that it does without the strength supporting it, that's when you have disc issues. You can create nerve issues as well, and then it leads to pain. All right, so this is Ian Hart with a thoracic mobility program that you can do pretty much anywhere. The only thing you might not have is the band. Even at the gym hotels, you're going to have medicine balls. For the most part, you might have some bands. So you can do this pretty much anywhere, provided that you have even a basketball or a softball or something to that effect to start out with. That'll help you get into the extension. This is Ian Hart again with earthfittraining.com, BufordPersonalTraining.com, as well as backpainrelief4life.com and mybackpaincoach.com. See you on the other side.